Welcome back. This afternoon we're joined by Governor Greg Abbott.
He's agreed to talk with us today about the coronavirus and its impact on the Lone Star State. Governor, thank you for joining us this afternoon.
Yep, thank you so much.
My pleasure. Thank you all.
We're going to start with our first question. Do you believe you've made any type of missteps in reopening or having to backtrack with the mask order? And are you concerned about the political fallout?
So listen, when we're dealing with a pandemic like this, the focus really is not on politics. It's really on public health and safety. And we are seeing a massive spread of COVID-19 across the state of Texas, hitting our all-time record high in the number of deaths today at 174. We have a very high positivity rate. COVID-19 is spreading rampantly across the state of Texas. We have more than 10,000 additional cases, and so this is something where Texans need to be very cautious. I realize it is not quite as severe in areas like in Abilene, even though you all did hit some highs over the past couple of weeks, both in hospitalizations as well as the number of people testing positive. But we're in a situation now where everyone needs to follow the best practices. We have seen evidence showing that wearing face masks will reduce the spread of COVID-19. If everybody can adopt that over the next 4 weeks, as the director of the CDC said, it will lead to a slow in the spread of COVID-19, and we will be able to get this under control.
Governor, it's been 3 weeks since your order to shut down bars and reduce capacity in restaurants. Do numbers show that's been effective in slowing the spread of COVID-19 so far?
So there are numbers where we are looking primarily at the larger urban areas like the Dallas-Fort Worth Metroplex, the Houston area, the Austin area, etc. There's a study that will be coming out, I think, on Monday from a doctor at UNT Health Science Center showing that wearing face masks actually has led to a slowing of the spread in the Dallas-Fort Worth area. We think the same thing is true in other areas. It doesn't mean that we have crushed COVID-19 the way we need to, but it looks like it has begun to slow the spread, and we've reached a plateau. Whether or not we go up or down from that plateau will depend upon whether or not Texans are rigorous in this requirement of wearing a face mask until we have medicines that are able to treat people who get COVID-19.
Thank you, Governor. And adding on to that, Texas has recently reached a grim milestone of 10,000 new COVID cases daily. This is far higher than the level we saw in March and April when you closed non-essential services and businesses. Is there a specific metric you're looking at when it comes to closing them again? Is there going to be another shutdown coming to Texas?
So the goal isn't to shut down again, and again, if people will follow the practice of wearing a face mask, it will allow us to avoid a shutdown. The last thing that we want to do is to shut our economy back down again. I've heard from blue-collar workers to people who earn a paycheck on a weekly basis to business owners, and everyone agrees that shutting down again is the last thing that we should do. And so we're working to avoid that, and the best way we can avoid that is to make sure that people do adopt this safe practice of wearing a face mask.
Governor, there are concerns about the accuracy of the case numbers reported from institutions. What is the state doing to ensure Texans can trust this data?
So the way this data works is it's initially generated at the county level, and county health authorities will provide it to the state of Texas, and the state of Texas then reports it. There was a recent clarification of some data out of San Antonio earlier this week. So the state works constantly with local authorities just to make sure all that information is accurate.
Okay, now heading to schools now. The TEA has been updating guidelines for weeks now, but I think one question that many teachers are concerned about is regardless if they're more at risk to get infected with COVID-19 or not, will any teacher, regardless of age or pre-existing conditions, have the option to teach remotely if they feel unsafe?
So the whole strategy here is to create a setting so that it will be safe for teachers as well as students as well as parents, and that is why you saw this guidance where school will be allowed to be open in school if it's going to be safe that way for all concerned. If it is not going to be safe to open up physically right now, schools can open up with distance learning strategies, but the goal has to be this, and that is we cannot lose a generation of students who go uneducated. So it is essential, if schools cannot physically open up, that they are able to deliver quality education online or through hand delivery to their students.
What's the protocol when a student or teacher does test positive for COVID-19?
So that was part of the plan that was released today, and that is if a teacher or student or anybody else in a school setting tests positive for COVID-19, the school is allowed to be able to shut down for sanitation purposes for a period of time, but during that period of time, the school will be required to provide online learning to their students.
How long do you envision in-person instruction lasting for?
So in-person instruction, well, the goal would be to have in-person instruction for most of the school year. The thing that none of us know right now is what the status of COVID-19 is going to be, let's say, in late August. Remember this, and that is the status of COVID-19 today is completely different from the way it was at the very beginning of June. And the way we've seen this thing move around, it could be completely different in late August or early September. But no, also, and that is perhaps by late August or almost certainly by September, there should be medical treatments for people who test positive for COVID-19. Those medical treatments will be coming up before the vaccines will come out, and we'll see how that further alters the status of things like schools opening and businesses remaining open.
All right, Governor, thank you so much for joining us live from Austin here on KRBC News at 5 o'clock. Thank you so much, sir.
My pleasure. Y'all be